All right. Greetings to our viewers. Evergreen Certifications here comes to you with Dr. David Pratt, who has been one of our exceptional advisors on the CBT certification that Evergreen Certifications is offering. So, good morning to everyone and welcome, Dr. Pratt, for being here today. Um, I would like to give you an opportunity to go ahead and introduce yourself to our audience, just giving them a little background in terms of your expertise, and we will get started with our questions.
Okay, well, first of all, thank you very much, Rebecca, for inviting me to this opportunity to talk about the CBT certification with Evergreen. I'm so excited to be able to talk about this because this program has tremendous benefits, I think. In terms of myself, I'm a licensed psychologist, and believe it or not, I have 45 years experience as a licensed mental health professional. I've been doing PESI trainings for many years, done many PESI trainings, and have thoroughly enjoyed that process and thoroughly enjoyed working with you, Rebecca, to take the trainings that we have done with PESI and turn it into an opportunity to get certification in CBT work specific to child and adolescent mental health conditions.
Absolutely. And I'm so happy you mentioned that because we've had other advisors come on in regards to this particular topic, the CBT certification. But what's very special about today's conversation is the application of CBT with children and adolescents. So as you all can see here, we have our web link where if you want to learn a little bit more about the certification, you can just go to evgcert.com/Pratt CBTC. And now we're going to go ahead and jump into our questions. So the first question that I have for you today, Dr. Pratt, is what can you share with our viewers about why a certification in CBT for children can be extremely valuable to their practice?
Okay, well, that's a great question to start off with, and there are many things that come to mind, but maybe the first and foremost is, CBT is one of the most widely researched and most effective treatments we have. Certainly, there are many evidence-based effective treatments, but CBT has a history of 50 plus years of research. It's been shown to be effective with both adult and child applications. Almost any childhood disorder you can think of, depression, all the various anxiety disorders, trauma, suicide prevention, disruptive behavior disorders, you name it, CBT is an evidence-based application for that. So this training is an enormous opportunity for a clinician to learn an essential skill, CBT, and how to apply it with a variety of conditions that you're very likely to encounter as a child clinician. So I think it's an opportunity to be extremely well-grounded in one of the best and most effective treatments we have.
Awesome. Thank you so much for sharing that. And my next question, I want us to talk about, CBT for kids. What needs to be considered by the provider and how it is applied differently from working with adults?
Well, that's another great question because, PESI has a great curriculum from Dr. Leslie Sokol, and there is a CBT certification for adult interventions. And I've taken Dr. Sokol's course, and I am an adult certified through Evergreen in adult CBT. And I have tremendous respect for Dr. Sokol and her program, and I recommend everybody take it because it's a great training program. But it's for adults. And so with all respect to Dr. Sokol's program, there are certain limitations to that program. There are certain things she does not cover because it's for adults and not for kids. For example, there are certain diagnoses that are child-specific diagnoses that are not covered in Dr. Sokol's program. You don't get anything in Dr. Sokol's program on oppositional defiant disorder, attention deficit disorder, separation anxiety disorder. But you'll get those in the CBT certification program because they're child-specific diagnoses.
Mm-hmm.
So you're going to get all the trainings that she does. I mean, you'll get the child-oriented trainings, but for depression and anxiety, but you're going to get the specific disorders for children as well. Now,
Right.
when it comes to the depression components, the anxiety components, the trauma, Dr. Sokol does a great job of teaching CBT for that. But they're for adult applications. And a child is not a mini adult. A child's a unique individual in a unique developmental stage. And you, as a clinician, need to have unique, developmentally appropriate application skills. Okay. It's not easy to teach a kid. It's not easy to teach CBT to adults. It's harder to teach CBT to kids in many ways because they don't have the cognitive sophistication that an adult does, the abstract reasoning skills. Now, kids can learn these. I mean, I've been doing this for years and years and years, but it takes a specific application.
Mm.
The didactic training that goes into this and the case consultations that are part of the certification, you're going to learn hands-on methods to teach this in a developmentally appropriate way to kids, to little kids even. 5-year-olds I do this with. I teach 5-year-olds how to do CBT skills, okay? So we're going to cover child-specific diagnoses that aren't covered in adults. We're going to talk about developmentally appropriate applications. And in addition, there are certain triggers that are going to be commonplace for adults, okay? Maybe marriage is a trigger for an adult issue with anxiety. Maybe work is a trigger for an adult. Well, we're not talking about those triggers with kids. We have to understand kid-specific triggers. So maybe bullying is a trigger. Maybe academic achievement is a trigger, okay? Maybe sports and athletics are a trigger, okay? So this is going to have many unique applications to kids. I highly recommend Dr. Sokol's course, but if you really want to go out and present yourself as a child and mental health clinician, I think it's great to take the child certification program because it's going to have all these applications for kids.
Awesome. Thank you so much for sharing that. And yes, on our website, you'll be able to see the variations in terms of the different tracks that you can utilize in order to obtain this particular certification. So thank you for mentioning that, Dr. Pratt, for our audience.
Sure.
My next question is, why do you think this certification is so important, considering many providers would say that their modality of choice coming out of graduate school is CBT?
Well, I certainly recognize that. And again, with all due respect to all the graduate school training programs and all the great clinicians out there, I don't think I would offend any graduate school program in the country by saying there isn't a graduate school program that's going to tell you they can teach you everything. Okay? They know they can't teach you everything. All right? And graduate school programs have to meet accreditation criteria. Okay, there's a broad accreditation criteria for every graduate school program that's out there. So there are many competing agendas in any graduate school curriculum. And every graduate school faculty member and administrator is going to admit they can't cover everything. At best, they can give you a good sampling of CBT. And I would expect most graduate school programs are going to give you a fairly decent sampling of CBT. There may be a handful that have specialized faculty with expertise that are going to go into more depth. But I think I can say this quite safely without offending any graduate school program out there, that this program is going to take you well beyond what most graduate school programs can teach you. The didactic component here is 28 hours. That's a lot of training, okay? Specific to CBT and these various child mental health disorders. Um, and then the case consultation is going to help you present cases to an experienced certified clinician who's going to help you learn how to apply this, help you translate the didactic into real intimate applications in the real world and
Mhm.
deal with the minutiae that's involved in that. Not minutiae in terms of trivial or not meaningful, but in terms of the details of how to do that with kids. Okay. So, with all due respect to graduate school training, I know myself. Yeah, I had great professors, great trainings. Most of what I do today, I learned after graduate school. And I think most clinicians will acknowledge that. We have to have continuous learning. Okay. So, for the fairly new clinician, this is going to be a great course. But let me not limit it to the recent graduate. You know, I've done lots and lots of trainings with very experienced clinicians, and they know a lot about CBT. But I'll tell you, many of them come up to me at breaks or after the program and they say, wow, I didn't know if I was going to learn that much, but I learned a lot.
Mhm.
And again, with all due respect to the experienced clinicians out there, is there's lots of things for us to know and to learn. And even if you're a pretty experienced person and you got a good foundation in CBT, there's oftentimes a drift from the model, you know, over time. And to take this course is going to re-ground you in the basics. Not only the basics, because we're not just covering, you know, traditional CBT. We're covering the more recent so-called third wave approaches. You know, DBT is integrated into this. Mindfulness approaches is integrated into this. Acceptance and commitment therapy, polyvagal theory and therapy, the growth, the positive psychology approaches. This is all the most recent and current treatments, so-called third waves, integrated into the more you know, familiar first and second wave or traditional CBTs. So I highly recommend this for the experienced clinician to get regrounded, and you may be surprised. You'll probably come away saying, "Wow, I didn't quite get that. I'm glad I took this. I'm a better therapist for this."
Wow. So, what you just shared is how advanced this certification will allow someone to be in CBT.
I
Thank
think
you.
that this is covering CBT basics, CBT intermediate, and advanced skills. Okay, and I'm pretty confident in saying this is going to enhance your skills, whether you've been out there, you know, 2 years, 10 years, 30 years.
Wonderful. And my last question for us today is how does this particular training, right, incorporate trauma and maintain a trauma focused lens?
Well, I think that that's a really important question because unfortunately, it's all too common for the kids we work with to have experienced trauma. You know, unfortunately, there's a lot of kids out there who have many challenges. There's discrete traumas. You know, there can be motor vehicle accidents. There can be date rapes. It could be, community violence. But there can be complex traumas. Kids who are experiencing tremendous life challenges and traumas almost on a daily basis. And it's hard for me to imagine being a good child and adolescent clinician if you don't have a rock solid approach to treating trauma. So this training is going to give you exactly that. It's going to give you a rock solid foundation in treating trauma. There's a whole module on CBT and evidence-based treatments for trauma. You're going to get a whole discrete training module on that. Okay. And you are going to get the gold standard training in how to treat trauma with kids and adolescents through this certification process, through the didactic program and then the case consultations. But in addition to that, I mean, if you've got a kid with trauma, it's very likely they're going to have a comorbid mental health condition in addition to their trauma. Okay. It's very likely they're going to have a depression, an anxiety disorder, you know, suicide, you know. So you are going to get training in those frequently encountered comorbid conditions. And we're going to teach depression, anxiety, suicide prevention, whatever it is, that's the comorbid condition, from a trauma lens, from a trauma sensitive perspective, always in keeping in mind that you very often have this in combination. And we'll talk about, well, how do you juggle all these agendas? Okay. And we'll help the clinician learn to make good judgments along those lines. So I think you're going to get a really good experience working with trauma in terms of a discrete training module in how to treat trauma, but then in all the other modules about the commonly occurred comorbid conditions.
Wow, thank you so much for your time today. We truly appreciate you spending this morning with us in order to share these intricate details about the CBT-C certification through Evergreen Certifications, and also the discussion around the content that you would need to be able to take in order to qualify for
Yeah.
this certification. So in order to learn more about other aspects of the requirements, the qualifying requirements for the certification, please either scan the QR code that you may see here or utilize the link, the URL that you see at the bottom. Thank you all so much for being here. You want to say a last word?
One last thing, if you don't mind,
Of course.
Rebecca, I just want to reassure people. It can be intimidating to think about doing case presentations with an experienced therapist. Okay, it can be. I've had to do it on a number of occasions, so I know what it's like to put yourself on the line. I want to reassure you. The whole idea behind this, the whole spirit behind this is how can we help you be a better clinician? The idea is not, I gotcha. The idea is, how can I help you learn to take the didactic skill and apply it and enhance your skill in a supportive manner in those case consultations. So don't be intimidated by that. Okay.
Awesome. Thank you so much for that. And that speaks to who we are as an organization, why we create these certifications. It's really about enhancing our providers' already skills that they have as a result of obtaining their degrees, licensure, but how can we just help them to fine tune that? So thank you for adding that piece to it, Doc.
Sure. Thank you for having me.